I had a patient last week, we'll call him David, who came in completely overwhelmed. He was juggling both me, a rheumatologist, and his dermatologist for psoriatic arthritis, and he was tired of having to repeat himself to both of us. When I asked him about his symptoms and his recent derm appointment, he just looked at me kind of defeated and definitely annoyed and asked, "Did you not receive my dermatologist notes?" And I hadn't. I've been working with David and his psoriatic arthritis for just about a year, but he'd been playing this back and forth game for much longer as he had seen a few different doctors since his diagnosis. I completely understood his frustration, but at the same time, I didn't have an easy fix. I had tried to get a hold of his dermatologist, but between my schedule of running between 2 medical centers and teaching, and who knows what kind of craziness his derm was dealing with, we just hadn't been able to connect. And I usually did get his doctor's fax notes, but about 2 months too late. This left David stuck in the middle. His joints were improving, but his skin wasn't. And although I had ideas on how we could move forward, I wanted and honestly kind of needed the guidance from his dermatologist, as David had already tried a few different medications. But then I reminded David that although the lack of communication between me and his derm was definitely a problem that needed to be fixed, we didn't want to lose sight that he was in charge of deciding which symptoms we focused on. So we sat down and together and figured out what mattered most to him. David told me that his joint pain was making it hard to work, but he was also self-conscious about the visible patches of psoriasis on his face and hands, and actually was more interested in getting that better right now. That insight helped us prioritize our treatment options and gave me a framework to discuss with his dermatologist. I also quickly laid out a simple template that David could use to quickly track what each of us thinks during our appointment so he can quickly and easily relay to the other doctor, acknowledging that even though I would keep trying, I couldn't guarantee the communication problem would be fixed quickly. If you follow the link in the bio, you can find that template for yourself and download it for you to use. So if you're feeling stuck between specialists like David, remember, you're the expert on your own life. Speak up, share your priorities, and keep the bigger picture in mind. Have a great day.